Beside from urine, CSF, semen, synovial, and serous fluid, we will tackle about two body fluids that make you awful or disgusted. Hi, I'm Kit Christian Pregunta, first presenter of the sixth group, and we will talk about fecal specimen and vaginal secretion. Let's talk about the routine analysis of feces. Routine fecal examination analyzes and detects some clinical significances and disorders such as in gastrointestinal system, such as small and large intestine. Let's talk about the physiology of feces. Okay. Fecal specimen contains bacteria, cellulose, undigested foodstuff, GI secretion, bile pigments, cells from the intestinal walls, electrolytes, and water. And it is approximately 100 to 200 grams of feces is excreted in a 24-hour period. Small intestine is the primary site for the final breakdown and reabsorption of ingested proteins, carbohydrates, and fat compounds. Trypsin, chymotrypsin, aminopeptidase, and lipase are the digestive enzymes secreted into the small intestine by pancreas. And we have about 3 milliliters are reabsorbed by the large intestine, the 3,000 milliliters of water. And let's talk about diarrhea and constipation. Diarrhea is having too little water absorbed that can cause watery feces, and constipation is a too much water absorbed that can cause hard feces. Let's talk about diarrhea. Diarrhea is defined as an increase in daily stool weight above 200 grams, increased liquidity of stools, and frequency of more than 3 times a day. Let's talk about illness duration, the acute and the chronic. Acute is the sudden or short span of time, and chronic is the long span of time. So acute diarrhea lasts less than 4 hours, while the chronic diarrhea lasts more than 4 weeks. We had the major mechanisms. First up, the secretory diarrhea, and it is the increased secretion of water caused by bacterial, viral, and protozoan infection. Second, the osmotic diarrhea. It is caused by poor absorption that exerts osmotic pressure across the intestinal mucosa. Maldigestion and malabsorption can contribute to osmotic diarrhea. Third, the intestinal hypermotility, and it is the excessive movement of intestinal contents to the gastrointestinal tract that can cause diarrhea because the normal absorption of intestinal contents and nutrients cannot occur. And let's talk about the steatorrhea. Steatorrhea, or also known as the fecal fats, and its detection is useful in diagnosing pancreatic insufficiency and small bowel disorder that can cause malabsorption. And we have what you call D-xylose, and it's the sugar that does not to be digested but does need to be absorbed to urine. If you have low D-xylose sugar, we will be having malabsorption that can cause steatorrhea. How to collect the specimen or how to collect feces? We collect the specimen in a clean container such as the disposable container, and we will transfer it to laboratory container. And it must not be contaminated with urine, toilet water, or preservatives for ova and parasites. Let's talk about the macroscopic screening. We have two tests in macroscopic screening. First one is the color. Color can detect some possible causes as shown in the table. For example, the brown color of feces. Brown color of feces results from the intestinal oxidation of stercobilinogen to urobilin. Next up, the appearance. Appearance can detect some possible causes by determining its appearance, like watery feces that results in diarrhea because of the poor water reabsorption in large intestine. Next up, the microscopic screening. First, the fecal leukocyte, and it has a principle of microscopic count of neutrophils in smear stain with methylene blue, gram stain, or right stain. Kahit saan dyan sa tatlo, gagamitin for the fecal leukocytes. And its interpretation is 3 per high power field, and it indicates the condition affecting the intestinal wall. Second, the muscle fibers. It is the microscopic examination of the feces for the undigested striated muscle fibers. And we have more than 10 per high power field interpretation. And lastly, the qualitative fecal fats. As you can see, we have Sudan 3, and this used in microscopy, specifically in our subject, the clinical microscopy. And microscopic examination of direct smear stain with Sudan 3. In its interpretation, we have 60 large orange red droplets indicates malabsorption. And in second one, and the smear heated with acetic acid and Sudan 3, we have 100 drops. Next up, the chemical testing. We have several tests in chemical testing. First up, the occult blood. Occult blood is the most frequently performed fecal analysis. And we have 3 types of occult blood. The guaiac-based occult blood test, immunochemical fecal occult blood test, and porphyrin-based fecal occult blood test. But the most frequently used screening test for fecal blood is the guaiac-based occult blood test, or GFBOT, or rather GFOBT. And its principle is pseudoperoxidase activity of hemoglobin liberates oxygen from hydrogen peroxide to oxidize guaiac reagent. And if you see blue color, that indicates gastrointestinal bleeding. Next up, the quantitative fecal analysis. And it is the confirmatory test for steatorrhea. An example is the Van de Kamer titration. And its interpretation is approximately 80% of the total fat content is measured in this test. Next, the alkali denaturation test, or the APT test, or fecal hemoglobin. Its principle is addition of sodium hydroxide to hemoglobin containing the emulsion determines the presence of maternal or fetal blood. And if you see pink color, that indicates presence of fetal blood. Next, the fecal enzymes. We have 2 enzymes na nakapaloob sa fecal enzymes. The chymotrypsin or elastase 1. Chymotrypsin is the most resistant to intestinal degradation and most sensitive indicator of less severe cases of pancreatic insufficiency. And its principle, the specimen is placed on the X-ray paper that determines the ability to digest gelatin. Kung hindi na-digest yung gelatin, that indicates lack of trypsin. Second, the elastase 1. Elastase 1 is the isoenzyme of the elastase and produced by pancreas. And its principle is the immunoassay using the ELISA test. And if you see pink color, that indicates presence of fetal blood. And lastly, the carbohydrates. In carbohydrates, as you can see, in carbohydrates, if you have increased carbohydrates in stool, that produces osmotic diarrhea. And its principle is the addition of clean test tablets to emulsified stool detects presence of reducing substances. And if you see the reaction of 0.5 grams per deciliter reducing substance, that suggests carbohydrate intolerance. Next up, the vaginal secretion.
I'm Raven and I am the second presenter of the sixth group. Vaginal secretions are examined in the clinical laboratory to diagnose infections and complications of pregnancy for forensic testing in sexual assault patients. Vaginitis is one of the most common conditions diagnosed by healthcare providers for female patients, particularly women of childbearing age or women with their reproductive years. It is characterized by vaginal symptoms including discharge, odor, itching, irritation, or burning. Careful microscopic examination of fresh vaginal secretions is necessary to determine the causative agent for each syndrome and to provide the appropriate treatment for the patient and, in some cases, the sexual partners to avoid reinfection. The specimen is collected by swabbing the vaginal walls and vaginal pool to collect epithelial cells along with the vaginal secretions. The healthcare provider performs a gross examination of the vaginal secretions and then places the swab in a tube containing zero point 0.5 to 10 ml of sterile physiologic saline. These are the diagnostic tests in vaginal secretions. First is pH. Ang tatandaan lang natin sa pH, ang normal pH ng vagina is 3.8 to 4.2. And an increase or a pH higher than the normal vaginal pH is suggestive of vaginal infections such as bacterial vaginosis, atrophic vaginitis, and trichomoniasis. During wet mount examination, a sample of the vaginal discharge is placed in a glass slide mixed with a salt solution. The slide is looked at under a microscope to determine the presence of constituents such as squamous epithelial cells. Clump of epithelial cells is an indication of the presence of increased number of yeast. Blue cells, diagnostic of bacterial vaginosis. White blood cells greater than 3 plus in vaginal secretion suggest vaginal candidiasis, atrophic vaginitis, and other infections with microorganisms. RBCs can be confused with yeast cells and are distinguished from yeast cells by potassium examination. Parabasal cells, if present with large number of WBCs, can indicate this squamative inflammatory vaginitis. Bacteria, yung lactobacillus, yun yung comprises the largest portion of the vaginal bacteria. It produces lactic acid that maintains the vaginal pH between 3.8 and 4.5. Trichomonas vaginalis is a parasite that causes inflammation and infection in women. Yeast cells such as Candida and non-Candida species cause most fungal infections, but occasional yeast is present or part of the normal flora. KOH preparation, dito yung mas pinapadali niyang makita yung yeast because sabi ko nga kanina, RBCs is sometimes confused as yeast at ginagamitan siya ng potassium preparation to make it easier for the yeast to be identified. During amine whisk test naman, is a strong fishy odor is indicative of a positive result. Such result may suggest either trichomoniasis or bacterial vaginosis. Gram stain is the gold standard in identifying causative organisms for bacterial vaginosis. Culture gold standard for detecting yeast and trichomonas. DNA testing, proline aminopeptidase assay, OSOM, trichomonas rapid test, OSOM, BV blue test are the confirmatory tests in the diagnosis of vaginitis. Ano nga ba yung mga normal na makikita natin sa vaginal secretions ng kababaihan? First is white flocculent discharge. pH niya is normal, which is 3.8 to 4.2. Amine with dust is negative, which means it has no strong fishy odor. WBCs is less than 3. Lactobacilla is predominant, which maintains the vaginal flora to its normal state. Other cells is RBCs that can be present during menstruation. Yung clinical features and laboratory findings in vaginitis, this table would be further discussed in the following slides. Bacterial vaginosis, the most common cause of vaginitis of women of childbearing age. It occurs when there is an imbalance in the ratio of the normal vaginal bacterial flora. Normally, the vagina has an environment containing both good and bad bacteria, and an infection occurs when the bad bacteria outnumbers the good bacteria, which is the lactobacilli. This upsets and throws the vaginal environment out of balance. It can be caused by the use of intrauterine device, douching, pregnancy, and lack of protective lactobacilli. According to AMSEL's diagnostic criteria, these are the gold standard that should be present in the diagnosis of bacterial vaginosis. First is thin, white, homogeneous discharge, which can be same as the watery appearance of a skim milk. Yung pH na is above normal, which is 4.5, has a fishy odor, which is positive Leaf test, presence of clue cells on microscopic examinations, and treatment niya is metronidazole and clindamycin. Candidiasis is an infection caused naman by the yeast candida. An infection occurs when the vaginal environment changes, causing the overgrowth of the yeast candida. Yung changes can be caused by antibiotics, oral contraceptives, pregnancy, ovulation, and menopause. Clinical symptoms niya ay genital itching, burning, dyspareunia, which is pain during sexual intercourse, dysuria, which is pain during urination, presence of abnormal thick white cord-like vaginal discharge, such as cottage cheese. The pH remains normal, and amine test is negative, which means it has no indication of strong fishy odor. Next is trichomoniasis. It is caused by the parasite Trichomonas vaginalis. An infection is classified as an STI and has been associated with enhanced transmission rates of HIV. Yung symptoms niya is meron siya nung itching and strong fishy odor na makikita sa first two vaginal disorders, and it is characterized by green to yellow frothy vaginal discharge. Frothy, which means small bubbles. Patients may present with a strawberry cervix because of punctuate hemorrhages, and treatment niya is metronidazole. Desquamative inflammatory vaginitis. It is a syndrome characterized by profuse purulent vaginal discharge, vaginal erythema, and dyspareunia. This syndrome also occurs secondary to atrophic vaginitis in postmenopausal women as a result of decreased estrogen. During microscopic examination, it reveals large number of WBCs or BCs and other organisms. Treatment niya is 2% clindamycin. Lastly is atrophic vaginitis. Atrophic vaginitis is a syndrome found also in postmenopausal women. It is a syndrome caused by thinning of the vaginal mucosa because of reduced estrogen production and decreased glycogen production. Dahil habang tumatanda yung kababaihan is bumababa rin yung production ng glycogen and estrogen nila sa katawan. Yung symptoms na, it can cause vaginal dryness and soreness, dyspareunia, inflamed vaginal mucosa, and purulent discharge. pH na is greater than the normal, and amine test is negative, which means it has no strong fishy odor. Treatment naman niya is estrogen replacement.
And that's the wrap up of the Fecal, Specimen, and Vaginal Secretion. Once again, that's Raven Ramos, our leader. Kenya Rosario, our assistant leader. I am Key Christian Pregunta, Justin Resultan, Sagiped Dina, Posadas J. Mark, and Rochelle Sagun and Rosario Arshel. On behalf of our group, thank you for listening. Stay safe and God bless.